proud.
Apology.
That's okay. We're very proud to have Nancy, the CEO and founder here, also who was recently awarded her honorary degree of letters by the university in recognition of her tireless and groundbreaking work leading the charity for more than 20 years. So Nasio's model is to empower the people and the communities starting at a point for social change, mid to eradicate poverty and helping unlock leadership potential. Nasio also works to tackle underlying causes of poverty, and for this reason, Nancy has been working with Walker Institute and our associates across the university in helping develop a regenerative agriculture program. So thank you very much, everyone, and yeah, I'm really excited to hear you guys speak.
Thank you, Daniel.
Thank you, Dan, for that introduction. I think one of the things we thought is really important to tell people how we started and why we started where we work. So we started in 2001 when my 79-year-old mother found an abandoned 3-month-old baby. And by the time I went to visit, he was 6 months old. But that brought the thought, why would a woman abandon a baby in a remote area? Most people tend to abandon babies in cities because they know someone who will pick up the baby and look after the baby, but not in the village. This was very unusual. So it got me thinking, what's really going on here? So that's how Nasio was founded. And Moses now is, that's how he was found. That's him now. He's graduated and he's got specialism in dentistry. So he's a man. So where do we work and why do we do that? So that one initial child being found and then thinking of what's going on here prompted to us looking at what actually is going on in the area. So when you look at the map, we are on the Trans-Sahara route. So we are literally an hour away from Uganda. And so historically, HIV would have traveled around the Trans-Sahara route. And so we would have been, as Mumias, have a very high HIV positive prevalence. And because we are under the Kakamega County, that kind of area. The average, which has now improved, the average lifespan of men normally would be 35, women 45. And so when we started, a lot of the children we were supporting were total orphans through HIV. But that has really changed, and we'll tell you why that has changed over the years. Population numbers, again, it's very rural, high population numbers, relied on cash crop because it was a sugar factory which then closed, making about over 5,000 people unemployed, but also creating a situation where going from cash crop suddenly being subsistence farmers is a massive transition. And as we go along through our talks, we'll tell you why and how, for us, working the Walker Institute and looking at climate change is a very, very important part of what we do. So I'll hand you over to Eunice, but before I do that, is what do we then do? So we do education, healthcare, and sustainable development. Because most charities focus on one thing. They'll focus on either water or health or sustainable livelihoods. But we realize that communities need a holistic approach. They need their education bits looked into and developed, women empowered, young people empowered, educated, and also their health. Because if you have sick people, they cannot look after the children, they cannot work. And you also need sustainable livelihoods, because if you have sick people who have no food, can't work, then the community has problems. So our model is very much about a holistic approach, where we have the centers of education, we have health, hospital, which is a health center, and then Eunice will talk to you about what she does within the sustainable development programs, which is the livelihoods. How do we get people from not having food to having food? Not having skills to having the right skills to meet their needs. So we call it the holistic approach. So it's almost the SDGs, but more picking on the relevant things that are relevant to the community's needs, rather than just doing the sustainable development goals. We do the ones that are relevant to the needs of our community. So I'll hand you over to Eunice, and then in between, I'll kind of jump in as we go through the presentation. Okay.
So good afternoon, Eunice, and I'm so honored to be here today. So I just share my story I met with Nasio 15 years ago when I was 14, and I usually thank God and the Nasio because I don't know my life will be the same. So when I met Nasio, I didn't know how my life will turn out to be. So they really took me as part of their family, and it was just lucky that we were invited to present a song in one of the events where they were opening a preschool. So it's called St. Irene. So in this event, I got connected with the Nasio Trust, and they saw some passion in me music, and then that's when we started being a family, and they supported me through school, where they provided me with all my academic needs, my education needs, and also provided me with food, because food is really a problem where I'm coming from because of poverty. Also, they've also supported me with school fees, where they paid for my secondary education and my college education. So in Nassau, we have this different structures that when I finished my A level, I didn't know what to do with my life. I didn't know which career to take. So I started going to different departments where I got some skills, but then I developed passion in social work. So I graduated and now I'm working with the social work team. And as a social worker, I'd say when you go to community, you get to see real poverty. And real poverty comes in terms of food insecurity. There's a lot of food insecurity in the community, and this has led to the rise in the malnutrition. So because there was a high rate of malnutrition in our community, we started a program which is called the Porridge Kitchen Program, where we identify children who are suffering with malnutrition. We enroll them into the program, and then we give them porridge, which is very nutritious. It is made of sorghum, millet, and soya beans, but then we supplement this porridge with spirulina, which is very rich in nutrients. We hold this session on a weekly basis, but we also make sure we empower them with skills. We give them flour to last them a week, but also we empower their parents to do agriculture. We empower them with trainings to do kitchen gardens at home, and also to get income. Then we also engage them into different livelihood activities that just help them to get income and support their family. So I think due to climate change and the rise in the food insecurity, you'll find that majority of parents leave their children behind to go to urban centers and other areas to just look for income to support their family, which is really challenging because that is where Nasio comes in. You go out to the community, you find a child-headed family with nobody elderly to take care of them. So they're just struggling to survive, and they don't have access to education, food, or healthcare. So I'll just briefly give you a case study of this girl here. I'll name her Casey. So Casey here was met by one of our community health promoters on their way to home visit or to some of our beneficiaries who are in the program. So when this community health promoter spotted the child, she really looked, she was in a really bad state. So she decided to take her to the medical center to confirm. So Rajab and the team ran a number of tests to the child, and it was confirmed that she had malnutrition and HIV and AIDS. So this was really difficult for the family because the entire family didn't know who was having HIV and AIDS and who was not having HIV and AIDS. So it forced us to go there, talk to the family, and help them understand that it was important for them to get this test, and it was also important for them to be linked with care. So it just confirmed that once they confirmed they were positive, they were all in denial. So our health, our CHPs really did a lot of work in supporting them, giving them psychosocial support until the family accepted and the child was linked to care. So this child, just apart from coming for the porridge kitchen session, we also conduct visits at home just to follow up and make sure she sleeps in a good place and she has got a mosquito net because it's a malaria zone and she's really taken good care of. And we also follow up on her medication just to make sure that she doesn't fall back. So Casey is now in school and she's receiving education and she's very happy and nobody will know that she's HIV positive. So this is just a story of KC, but we have so many children that we are supporting that are going through quite a number of cases, HIV and AIDS. Some are not even able because of the delayed milestone, and maybe they didn't get support at an early stage. So that is what we are dealing with back in the community. But as a social worker, I'm so privileged because I'm able to support my community anyhow with the little resources that you can get through the Nasio Trust to help them come out of poverty. Thank you so much.
Thank you.
Hello everyone, my name is Rajab Kweyu, one of the beneficiaries. I joined Nasio Trust at the age of 7 years old. I had 8 siblings and my father passed on, so my mother was the only one who was supporting us, could not afford to take care of us, went to the streets, and through all that I was able to join the Nasio Trust. So Nasio Trust has supported me through primary education, provided for food, clothing, home, and secondary education, worked hard, was able to join a medical college and graduated as a doctor. And I decided to come back and give back to my community. So currently I've been working with Nasio Trust. Some of the things that I do, we're having a medical center where we provide outpatient care. Patient comes in from home with different ailments. Other comes with emergency issues, malaria, tuberculosis, accident, and all those. So we're able to treat them. Also at our medical center, we're having a maternity unit. So a month, we're able to have 50 deliveries at our medical center in a month. And also we provide ambulance services and other services. Also, apart from working in the facility, I also deal with peer education. So I talk with young people. I go to outreaches and sensitization, talking to them about different aspects, peer education program, HIV, sexual reproductive, period poverty, and mental health. So those are just part of the duties and work that I work currently with. So also about health, about tropical diseases, as you know, HIV/AIDS, the prevalence in our community stand at 4.8%. And also there's a co-infection with hepatitis B because same mode of transmission, and also both of them are viral diseases. And we're also having the jiggers. Jiggers are flu-like. So actually that is the one. So that's how jiggers look like. So it's more like a flea. It burrows into the skin and makes it to look like. So it can affect the feet. It can go the way to the hands. And we're having so many kids. Apparently, last year, the only of last year, we were able to treat 250 children in our community who had jiggers. So it's usually very common because of poverty. People cannot access hygiene, they cannot be able to access good care. They walk barefooted because they live in a soil, which is a house which is made of mud. So most of the time is more of hygiene issues and that sort. So we do it. Treatment is surgical. You have to cut and then just let the eggs pop out and try and clean it. So that's part of the work that we do.
Just to add on that, it doesn't just affect children, it also affects adults.
Adults, yeah.
And there is a lot of stigma attached to jiggers. And so it's seen as you're poor and you are dirty. And so some of those children will not go to school because of the stigma attached to it. Some of the women will not go out because of the stigma attached to it, so they become more and more isolated. But also what is interesting with the jiggers is in Kenya, we use our thumbs to vote. So it also takes away the voting rights because you can't vote if you can't use your thumbs. Now, one of the things we were saying this morning is growing up in that community, we didn't have jiggers. So the question is, where have they come from? So we can only make assumptions. So assumption number one could be climate change. So some parasite, or you want me to stand up?
No.
So some parasite that would have been eating the jigger flea has probably died, or we're using a lot of chemicals on the farms because the sugar factory would use a lot of chemicals. So maybe because of all the chemicals, we've killed some parasites. So there's a problem in the ecosystem. Now with jiggers as well, we've done some research. It affects boys more than girls. More boys are affected by jiggers than girls. Basically because it's linked to hygiene. So boys will tend to, in the evenings, not wash themselves, play out the whole day, sleep on the floor. Like Rajab was saying, the floor is smeared with mud. So the flea lives in the dust. and it will go into their feet, their hands, their thumbs. Even I've met people who've got jiggers in their elbows. So it's very painful. I've had a jigger and you cannot sleep. And when it gets to that level, it's very serious and very difficult. Now, what Eunice also probably didn't mention, part of her community group and the women she supports, we've created a team of women called the Smearing Group. So what the Smearing Group do, which Eunice has trained them, is they will go and identify people in the community or children who have jiggers. They'll go and sensitize them, clean their homes, show them how to do it, smear their floor with cow dung. Now, there must be something in cow dung that treats and kills the parasites. So they will smear the floor with cow dung, come back and check again to see if the jigger infestation has improved. So she doesn't only make the porridge and do the porridge and malnutrition, she also does a lot of preventative work in the children affected by jiggers. So it's a holistic approach where it's preventative, and then of course by the time they come to Rajab, it's now treatment.
Yeah, so last year in July, we had one of our supporters who visited us, Dr. Katie from Oxford University Hospital, and she realized that we didn't have hepatitis B testing at our facility. It's because those services are not provided by the government and they are very expensive. So we started at our facility for the first time after she did fundraising. We started free hepatitis B testing. It was Dr. Katie and also Dr. Louise. And so far we have been able to do 900 tests, and we had 2 patients who are on care and on follow-up at our facility. As you're also aware, hepatitis B, when it's not treated, can lead to liver failure and cirrhosis. So we target a lot of pregnant mothers and also old people who are above 50 years plus, and also some of the people who are at risk, people living with HIV. And so at our glance, this is our HIV testing that we conducted. As you can see, in 2023, our numbers were at 1,600. That was just after COVID, so we didn't do a lot of training. And then 2024, we had more and more sensitization. So the numbers goes up. So more young people understand the importance of coming and doing the HIV testing and counseling. And then in 2025, we're just in May and already the numbers are up. So we're hoping that as we continue doing the sensitization, more and more young people will come out and they'll be able to test it. Also at our facility, we're having 154 adults who are on care, who are HIV positive. They come, we review them every month, and we give them medication. And we're also having 14 infants who are also on our care at our facility. Yeah, but now, as I also mentioned, we're having a challenge with the USAID funding, because the USAID funding was cut, and also the UK aid has gone down. Now we're having a challenge because even at our facility, we're only having drug stock for 2 months. So after 2 months, we just don't know what we'll give out to our patient. It's something very sad because now they cannot be able to access HIV treatment medication, and also having rising HIV infection because we don't have the test kits. And also for the infant, young children who have been coming and we give them medication, and also HIV positive mothers who have been on care, we are not able to provide them those services. And also, of course, the USAID was giving us TB medication and malaria vaccination. So also those ones have come to a standstill. And also we don't have research, and also some charities and programs which have been supporting through the USAID to support the HIV program. Now they cannot function, and people have also lost their job. So that's just part of the global and how the USAID funding has affected us as an NGO, and not just us, even other facilities and also organizations and programs which were set up to support the HIV, malaria, and tuberculosis. Yeah, so.
So in light of the USAID funding cut, we also wanted to highlight our partnership with the Walker Institute, because it's more and more crucial now to work with people that are like-minded and want to work back with us. So our initial relationship began with the big question that why are people in our community going hungry? Because as Nancy mentioned earlier, we work in a very, very fertile zone in the country. you throw a seed on the ground and there's crops growing. But suddenly, as we heard with what Eunice was talking about, there's increasing malnutrition. There are about 30 kids who are in our porridge kitchen program, and we started noticing this uptick and an upward trend in the number of kids who were turning up starved. And we realized that there is a crucial link to climate change in that. And we understood that on a local level. But when we actually had a look at the statistics, they were quite staggering. So apparently in the past half century, agricultural yields have dropped by about 35% in that zone and within the country as a whole. And that has had a cascading impact on other aspects of life. So there's obviously a reduction in food security. Youth are more vulnerable because they are leaving agricultural jobs and going into the city in search of work. There's increasing pressure on healthcare systems because unpredictable rainfall and drought mean that there are more displaced people, there are more vector-borne diseases. And with HIV, suddenly there's all of these limited resources are now being directed towards treating malaria and typhoid outbreaks instead of providing essential care for HIV. So with that context, we are now developing a program with the Walker Institute to introduce regenerative agricultural practices to the community that we work with as a climate mitigation strategy. And regenerative agriculture, for those who don't know, but I'm sure you know, includes techniques and practices such as mulching, intercropping, no-tilling, integrating livestock and cropping together. So it's quite a holistic way of farming as well, which we think that would be extremely impactful for our community. But before we actually jumped into implementing these new techniques, we wanted to actually see whether they are actually relevant and effective in the specific zone that we work with. And that's where the Walker Institute and its methodology really came in handy in a way. So the fact that Rosalind and Celia, in all of our conversations with them, they have emphasized that they want to work with the community at the local level and at the grassroots level and build capacity amongst the people that we work with, rather than having an external scholar come in from the West and then impart their knowledge on the local community. So that's something that we're really keen to develop, especially in terms of building the climate resilience of the communities that we work with. And also the fact that they are very long-sighted. So they always think about time in terms of decades. So this project is something that we envision to be 10 years long. So we're quite keen to work on them. And as a result, last July, we were able to work with Celia and the Evidence for Development to conduct an individual household methodology within a small sample of about 60 households. And this was from a village that is a typical sample village in the region that we work with. So it would have all the specific social indicators that we were looking for. And we noticed that about 16% of the households within that sample size were living below the poverty line, and they were earning less than $1 a day, which is not enough to survive. And that emphasis on the economic impact of climate change is what we're really keen to develop. And our next step now is to work with the Walker Institute to develop and analyze the climate risk that such communities are going to face in the future. And that will help organizations like us and other grassroots organizations to actually implement targeted and specific interventions that work for the local community. Yeah, but that's a general overview of how we're working with the Walker Institute and with the University of Reading. And in light of that, we would love to have your involvement as well. And as you've seen from what we've been speaking about, we do a range of activities. And you'll be more than welcome to come visit us in Kenya and volunteer with us and get a taste of what exactly that we do and make an impact yourself. Obviously, we're in a university, so we'll be really, really happy if you could donate your time and your research expertise to actually answer these critical questions that we are being contended with. And you could also just donate £5 a month and give healthcare to a whole household through the national healthcare scheme that Kenya runs. And then doctors like Rajab can actually look after the people that we work with. Okay. Thank you so much for having us.
Thank you. No, don't take us. Thank you so much.
You mentioned that the land is very fertile and so the crops can grow. So, so what is the effect of climate change? Does it mean that the crops which used to grow don't grow so well and you need different crops? Is that what, and you need to know which crops?
So two things have happened. The seasons have changed. Because traditionally people knew when to plant, when to harvest. The seasons were so predictable. But now what we find is sometimes people plant, the rains will come like now, they think, oh, that's it, and they'll plant, and there'll be no rain. And all those seedlings die. Sometimes they'll wait, hoping that the rain will come, then it doesn't come. Or sometimes they'll plant, then there's hailstones, and then everything is cleared. So we've noticed that the impact of climate change directly is the unpredictable seasons now. They're not, even here now, when it's May. I mean, yesterday, that's why I wore a scarf today. And then now it's raining. So I'm really confused. What am I supposed to be wearing? Even here now, you can tell May is very sunny. And it's more, you know, it's not, everyone says, oh, May shouldn't be like this. So we are seeing those subtle changes. The other thing that has also changed is, like I said earlier, there must be something in the ecosystem that has changed. So we can get very dry spells, dry seasons, and we get pests. So the crops, I can't remember what year was that? That all the crops were destroyed by some pest that was eating the maize. And so all the crops are just completely decimated by some insects of some sort or pests of some sort. And then population numbers. Like Rajab said, we deliver 50 babies a month. So you can imagine our culture, when you have a child, a son, you give them your land, because that's the only asset you've got. And so the land that would have been an acre gets subdivided. And so suddenly there's too many people, too many houses, very small farmland left. And so if you're a small scale farmer and climate hits, you're hit the hardest. Whereas if you're a large scale farmer, climate change hits you, you don't get as much as the impact as when you're relying on a quarter of an acre to feed the whole farm. Is there anything else?
Just one thing, that as maize is the staple crop, there are also a lot of invasive species. So there's something called striga weed, purple flowers. So it eats into the nutrients that the maize crop should be getting.
Yeah. So we are training, so part of, again, Eunice, the team's role is to train people into how they can improve their yields, training in good quality seeds, fertilizers, when to do it. We monitor we put them in groups of 10, we give them the team leader of our 4, and their role is to make sure we can tell them what's going to break, time to plant, and that information can cascade down. So we're mitigating the risks we can, but until we do better research with the Lives of Walker Institute, we're just second guessing.
And maybe just to mention that I had this conversation with the wings and I asked them, what do you think is causing this food insecurity? Then they told me, Eunice, we are confused. Then I was like, why? Because the season patterns have changed. So right now we don't know which crops will thrive in longer season and which crops will thrive in shorter season. And we don't know which is the shorter season and which is the longer season, because we just wake up this rain, we wake up this drought. So I think it's really confusing to them, and they're just doing trial and errors with the food.
Is the Walker Institute providing forecast subsidies? I'm in meteorology department, so are you providing forecasts? Do you know, Frank? Are you getting forecasts from the Walker Institute to help understand where to plant?
We're just at the initial, that's why maybe Celia can answer that. We're really at the initial stage of just saying that we need funding for starters to even be able to conduct that piece of research.
But that would be something
that
the Walker Institute could
help us with the weather forecast.
Access to that.
They have access to that, and the data collection, like Diva said, at household level, and who, you know, what to plant when, and what the weather is doing to avoid this confusion. And the people that are most hit are women and children.
And most of the crops grown for the family to eat by itself or to sell.
It's not enough to
It's
sell.
not, it's to eat for
Yeah,
themselves.
because it's quarter of an acre, so it's just for the family to consume.
Maybe I could just say a little word there from the hello.
Hello, yeah.
And yeah, first of all, thanks so much for those amazing talks and those inspiring stories from both Rajab and Eunice. Just incredible to hear that and what Nasio has done to make it possible, but equally what you guys have done in coming back to your communities, which is not something that everybody would do. So that is so impressive. And thanks for sharing that with us. But yeah, I just wanted to say a point following up from the question around are people selling their crops? One of the things that we found in the detailed study that we did last year was that no, people are keeping the food that they produce, but that isn't enough. They're not self-sufficient in food. You couldn't call them subsistence farmers because the land is not sufficiently productive. Yields are so low that people retain what they grow, but they also have to earn money one way or another in order to just maintain that very basic subsistence. So I do think it's been very helpful to just get this data that shows the depth and the extent of poverty. And Nancy, I think I'm right in saying that despite, your enormous knowledge of that community, even you were shocked by some of the results that we were seeing. So clearly there is a huge job to be done just to try to better come to grips with these underlying causes of poverty. And I think here this is also where the climate piece is very important because, you cannot ethically, I suppose, encourage people to change a way of living, to adapt in a certain way, unless you can be, have good evidence to say, okay, the sugar factory has closed, people don't have this work available on site. So should they be growing more maize, or actually are conditions such that maize will be increasingly difficult? What are the connections? And again, this is where the links with research is important. And I know one of the recommendations after the study that we did was around linking up with a local agricultural research station where local, actually, I think it was at sweet potato vines were being developed. So anyway, just a few words about how the work is starting, but as Nancy says, so important and critical that we find a way of funding it to move forward. Thanks.
And thanks, Celia, for that. And I think to add on that, we're not isolated. There will be a lot of communities that globally that rely on hand-to-mouth type of living will be affected. And growing up as a child, the two things I never saw were jiggers and malnutrition. Nobody was ever malnourished. So this is also very important. I'm thinking it's so green, everything can grow. Why are children malnourished? So we are also, like we mentioned earlier, trying to develop some work with York University in Canada to look at the impact of malnutrition on child development. Because we're saying if these children are entering into the system, we're starting with Rajab, when women come for maternity checkups, are they malnourished? If so, what's the impact on the baby that will be born, and what will happen when they enter into the education system? Are they going to compete at the same level as their peers who are not malnourished? And Eunice has been doing a trial on the different types of porridge as well, because the porridge she gives, which she didn't go into detail, has got a lot of soya, sorghum, millet, and then we also add spirulina. So she's been trying with white maize, which is a staple food that people plant white maize, they harvest that, that's what they eat. So they're thinking, okay, if we want to make this porridge project sustainable, is it as good as porridge without millet, soya, and sorghum? And if so, then all we need to give them is spirulina, and then they put into their porridge, and the children will reduce malnutrition. So we've got amazing research opportunities for anybody who really, you can go to chickens, you can go to porridge, you can go to malnutrition, HIV. We're honestly, we're just like we are always looking for solutions, but we want them evidence-based. We don't just want to say, oh yeah, but this works, this doesn't. That's why for us, working the likes of Walker Institute, York University, Reading University, any department is so crucial because it's evidence-based, and we can then say to people, we've done it. Because people say, oh, there's a lot of research around malnutrition that's been done. We're saying, yes, but we are tracking child development from pregnancy, because we have a hospital, all the way from a woman being pregnant, the first 1,000 days of a baby, and when they enter into school, because we also have the schools that they enter into. So we can really try, and we're saying it's not just a short research piece of work, it's 10 years. We want to track this child for 10 years. But the problem we have is funding cuts. Nobody wants to fund research, nobody wants to fund anything, nobody wants to fund. So that is the challenge we have.
And Nancy, do you want to say a bit more about spirulina, what it is and how we do it?
So spirulina it's now a superfood here for people who want to be super healthy, but also apparently it's good for vegans. We were funded to produce spirulina, and it's an algae, it grows in water. And so in fact, we've scaled the tanks because the demand is a lot higher. So when we were funded, the whole idea was that the priority, because it's high in protein compared to any other, and it's easier to produce, because we used to keep chickens and they would all die. Meat is expensive. And so spirulina was the easiest way we could still give our children something that had high levels of protein. We could produce it. The surplus we could sell to generate income to support other pieces of our work. So the spirulina, so we have nutritionists at the hospital. What they do, they go into the school and do the BMIs, they do all the checks with the children that are at school, the children that come through the clinic, the pregnant mothers, and then they'll say this one needs spirulina because they're malnourished, and then they track their health. Like you saw, the little girl was underweight, and then within a such short period of time, she was healthy. And you almost look at that picture, you can't believe it's the same child. Growing up, I never saw kids with those big stomachs. I used to see them on TV in Ethiopia when people are doing, what was it called, food aid? Food during the days of Bob Geldof or something. Band-aid. That's why I used to see this type of stomach. So to me, this is very, very new and really concerns me. And I'm just sat there thinking, we've got to understand the issues. We can't just, there's enough intelligent, clever people that can put resources together and come up with solutions. If they can help my community, they can help another community. If they can help my country, they can help another country. So anybody knows Trump directly or Bill Gates directly.
And so Bill Gates, because he does a lot of work with malaria, if I understand correctly. Is he able to give vaccines or?
I think they do fund on a national level. So they fund the government directly rather than smaller grassroots charities.
But he was also very focused on the under 5s preventative vaccination, which we were involved in, and we also track that. If a child under 5 has got malaria vaccination, how long does it take for them to come back to hospital? And if they do have severe, is their malaria? So we were involved in that, which bill gets funded. And we know he's saying he'll get rid of all his money by 20, whatever, when he dies. But we want it now.
Yes,
we want it yesterday. Our biggest challenge and worry now is HIV, because communities will go back as they were in the 70s, where people would be dying from HIV, which we had made such stride in terms of prevention, in terms of treating, preventative and treating, and now we'll go backwards. That's a big worry.
Thank you so much. It's a very interesting and really informative talk. Unfortunately, a little depressing as well. But I'm interested in your open previous conversations that I'm interested in the education side of things and the empowerment of girls and women. And I'd love to do some research with you. The funding, the funding issue is the same, for us here, trying to sort of identify funding providers that will, support. We've got to get the right bit between funding and the project and everything. But I know that you're doing other work around education and women's empowerment programs and to empower them economically. You're able to say a little bit more about that and how you could see working with the university from a research perspective, how you might have you got any ideas about how that might work?
So we all have a different experience.
Yeah.
So when we look at our data, the data population around that, we talked about lifespans of women, the live 35, the 45 for women, 35 for men. So we find, even if when Eunice works with women, you'll find the majority of the community adults are women. And they tend to, so we get different categories. We tend to get the young ones that drop out of school because of teenage pregnancy. We get the ones that are just poor and suddenly their parents cannot put them in school anyway, but they're still young. Then we get those who've been widowed because the husbands died, one or another. Then we get elderly women who outlived probably their partners or husbands. So we've got those different categories. Then, so I'll start at the education level. So in school, which what Rajab does, we do peer education program, because when HIV started, people focused on the adults, people forgot the young people. And so we realized HIV numbers among the youth was going up quite rapidly. And so we've been very privileged to be funded to do a peer education programs where we target schools and then we do preventative work at school. We also within the school, because some students will not want to be involved in peer education as in sex and condoms. And so we introduce young farmers clubs. So if you don't want to talk about sex and condoms directly, actually you're more interested in agriculture, but you don't realize we're also telling you about condoms and preventative measures. But within that, we try and encourage them to learn how to produce the food and surplus to sell, so almost economically empowering them. So that's done at education level. Then you get the community level where Eunice now gets in, where now they're outside in the community, either they're teenage pregnant, they're widowed. So it's a range of different age groups. And those ones are the most vulnerable. One, because their literacy numeracy levels are very low. Even if you gave them money, and we were talking about the office the other day, even if you gave them money to start a business, they just don't have the skills to get that business off the ground and make it work. You get that group of women. So what we do, which Eunice has, is we have different groups. So we've got the young mothers, we've got the smearing group, we've got this, and all these women we've identified over the years, been doing projects with them that we expect to be sustained, but they don't work because they're not educated, they have no skills. So now we realize what we need to do is train them in basic skills like table banking, social enterprise projects where you get a bit of money, you put it together as a group, you can then start a business as a group or start a business as an individual. But while you're also doing that, you're also being educated to understand money, counting, numeracy, writing, all that. So you are empowered in terms of training and input, but you're also given resources to kind of start whatever the project is. So we give them a loan that as a group, as part of the table banking, and they put the money in and borrow interest and all that kind of stuff, because they cannot even open bank accounts. Those are women who don't even have bank accounts because their numeracy literacy levels are very low and they don't have enough money for even the banks to allow them to open bank accounts. So they can only do this table banking and they locally work as a group. Is there anything else I've left you with?
I think in March we had a graduation of 10 women who have been, and one of them was just sharing that now she can go to different places and read different destinations.
She can travel.
She can also spell the husband's name.
Yeah.
So it was an adult education.
Adult education, yeah.
So we do adult education as well for these women who missed out of school and education. So we run weekly adult classes, and like Eunice said, we had the graduation for them. And for us, something we take for granted that we can look at science and know where we are. But if you're illiterate, you can't read, you can't write, traveling is a nightmare. And so for her, the only thing she said is I can write my husband's name, and I can read my Bible, and I can also travel now because I can read.
You can read the Bible, you can probably read anything. What is in that?
So we are, yes, the answer is we are very interested in any work and any research around women, because we also want to know what are the barriers that stops them from being economically empowered. It could be climate change, because if they're relying on planting vegetable that they'll use for their own consumption and self-surplus, and that fails. What next?
So the businesses that the women would start would be agricultural.
Some will be agriculture based, some will be soap. We talked about with the jiggers, you need basic hygiene in soap. So some are making soap locally and selling to the women who need soap. And that's there's a kind of barter trade going on. I sell my vegetable. And that's why when COVID happened, it was a really difficult time, because a lot of those people learned barter trade, and it still exists, because I will harvest my vegetable, I'll take it to the market, I'll sell it to you, I'll get the money, I'll buy bananas from you. It's purely just happening at the market. They're not going, it's just pure barter trade between products.
And they also exchange sacks of maize for school fees. So instead of paying cash, they just give like a 50 kg sack.
Some schools even accept chicken for school fees. So they tell you we want X amount of chickens. Can you bring in? And they value the cost of a chicken, and then they tell you now your balance is so much left. Got to breed more chicken. So very much at that level, very basic. But when it's very powerful, because they and Celia will confess that the household survey we did, it's the women who are the strongest economically. It's the women who are almost supporting the whole household.
Yeah. Can I
Yes.
ask a sort of a question that kind of relates to this, the connected approach that you have, which clearly, makes so much sense and is addressing underlying causes and looking towards people and their futures. But it is so, at one level, so obvious that's the right way to do it. Why it's obvious to us, but it's not obvious to everybody. So I'm just wondering if other NGOs in your, in Western Kenya, in the part of the country where you're operating, are seeing, gosh, Nasio is doing really interesting work and getting, very impressive outcomes. What is holding others back from the approach that clearly we see absolutely, yeah, why wouldn't you do it like that?
Bear in mind, when I started charity over 25 years ago, we had a lot of people who were quite skeptical, critical about and criticizing the model, saying you're doing too much. You're doing too much. Because the funder, when you think about foundations and funders, they only think in a certain way, and they just could not think. You're talking about holistic. How does that work? It's too much. But until they came and visited and actually saw how the whole thing is so connected. And this morning we were talking about the healthcare. So we run a hospital, which is not government, it's charity hospital, but it's also a business. So how do we fund it? So government does not give us money, but we have to run it. So every service is chargeable. Now, how do we make that work? So we have the women who Eunice works with, because it's only £5 a month to cover the cost of the whole household to access healthcare. It means when they come in, they can see Rajab, they can have blood tests, they can go to the pharmacy, and they can be treated. £5. But they'll tell you, I don't have £5, which is true, they don't. But what we do is we've got farms, because we are sustainable, we produce our own vegetables for the daycare centers. We'll say to them, do you know what, if you come and work 1 day a month, which is the £5 equivalent of a day's work, we will pay your healthcare. So they will come and they might say, oh, but I'm so sick. I say, yeah, but you've got your niece, you've got your nephew, someone who can work. So they'll come and work and they'll get the £5 to cover their healthcare for the whole family. Then we have the jiggers, because we realize now these women who have jiggers sometimes because they've also been tested, they can't work. We created a jiggers group of women who do smearing. So if they smear one house, that is equivalent to their healthcare for that whole month for the whole family. So we kind of work in a way that we look at the problem, we try and come up with a solution that works locally. Now, I was very privileged, going back to your question, Celia, I was very pleased one of our funders asked me to visit 5 of their projects because they wanted me to look at these other projects they fund with a fresh pair of eyes and see why aren't they doing what we're doing. Now, it doesn't mean charity one size fits all, because you also have to look at the context of the different communities. But some of it, as Cecilia, was very obvious. Like I went to one of them, they had a hospital and they weren't even thinking the way we were thinking. I was saying, but why aren't you having the health insurance where you get people insured? Because if every family is insured, say for example, I don't know how many people are insured in our books, 1,000?
Yeah, 2,000.
So 2,000 people are insured. They're not all going to be sick that month. It's simple math. They're not all going to be sick that month. They're not all going to come to hospital. So the ones who don't come, their money is profit. And now that profit covers their salary. So I'm like, yeah, good days. The hospital is sustainable because from the insurance. So we even do the drive to go out to encourage people to come and register at our hospital. We make sure the service is so good that people want to be registered at hospital because their insurance is our profit, which then sustains the hospital. We also support community health workers. We pay them a little bit so they go into the community to find pregnant women, because when a woman delivers in hospital, we are paid more. So the more women, that's why we have 50 women coming, because the more women, so it's a business, the more women deliver means we get more money. So bring every single woman. So this community health worker going out, convincing Eunice who's pregnant, say, you must come and deliver here. So she gets paid cash in her pocket. We benefit because the woman delivers in our hospital, we get more. So unfortunately, it's taking a bit longer for this model to go around. But with the changes with funding, most charities will either go under or change their model, unfortunately, because funders also need to catch up with what we're doing, because there's still very much, we only fund women, we only fund girls, we only fund education. We don't understand holistic because our brains can't work with holistic.
But that would be a very interesting, unexpected, but possibly good outcome of the terrible cuts. I mean, at one level, you could say aid isn't working, hasn't worked. The very fact that we see things getting worse, that model hasn't worked. One can only hope that being faced with, you change or you go under, that people will see, actually, it makes sense it's more economic to have this kind of cross-subsidizing and a more holistic and integrated way of looking at things. So hopefully that will come through. Nancy, could you say something a little bit about how you communicate across both the donor community and also within Kenya? Because I know, you're a small organization doing great things. What are some of the tools you use to try to kind of get the word out? If that isn't a crazy question.
Well, extremely hard. You get this donor who are so big on numbers. They want big numbers. And so if you don't have numbers, they're not interested in funding you. Now, we don't do numbers because we do individuals. And sometimes we struggle to break through those donors who want multiple. We get some donors say, you haven't reached 10,000 people. It's like, come on. So we look at the individual and the problems. But what we've learned to be so good at now, we've got the medical center has a medical system. That's why those numbers you saw Rajab shared, the HIV ones. So we have a medical system that we've invested in, a system that every single patient that comes through, we can track what they're suffering from, how far they've come from, what their needs are. But not only that, then it also helps the medical team. Say, for example, suddenly if malaria spikes, under 5's malaria goes up, they're like, what's going on? Is it raining? And there are no mosquito nets? What do we do? They will then send Eunice and her team to go out into the community because we have a social work department, and they'll go house to door to find out what's going on. When malnutrition spikes, they will go out again and do that tracking. We even have something called the mother's journey. So any woman who comes through, if she's pregnant, the medical team will find out whether she has mental health problems, she's malnutrition, all those things. They will also follow her as part of the journey. And when she then they will show her how to breastfeed. When she goes out, they will track if the baby is being breastfed. If not, why not? What's happening? Because we don't want that child coming back malnourished because we didn't track. So back to your question, how do we engage donors? So donors want to see sustainability, and we never start a project if we cannot sustain it. We're not doing it. And how do we say that? If we cannot run it after the funding, because most donors will only fund you 2 years, 1 year, 6 months, it's not sustainable. So we say to ourselves, like spirulina, we're going to build spirulina tanks, we're going to produce spirulina, and it means that after that funding, we can still continue producing spirulina. We're going to build a hospital. And how are we going to fund it? Through the insurance. And if we can't, then we're not building it. So when we approach donors, we talk about sustainability. We say, even beyond your funding, we will keep going. But we're also very clever. We go to the donor and say, it's just a pilot. Give us whatever, 10,000. We're just going to find out. When they give us the 10,000, we've got M&E teams. We collect the data. We go to them and say, oh my goodness, look at the impact. Can you now fund us? So most of 3 of our big donors, everything started as a pilot with less than £10,000. But now the biggest one is 200,000. We started with, was it 20,000? And so every year we go back and say, oh my goodness, look at what we've done, but this is what we need to continue doing. Oh my goodness, look at what, and we need to increase the number. So some of them, like agriculture, will say, we have 50 people, we only need to add another 50. Then we are very clever and say, actually, we've looked at the statistics. Women they're the main breadwinners, so we need to recruit more women. We also track their age. What age group are they? They were under 15. Oh, maybe we need to bring in youth who are under this. So we play around is the wrong one. We use data to influence and convince our funders. So the 3 main big funders have stayed with us and have just kept scaling because of that. We've won the best performing charity. That's why Eunice and Rajab are here, because out of 100 charities, we've been the best performing charity because we collect data, we monitor, we track, we follow through things, we report back on time when we can. And has that answered your question? So it's building a relationship with the funder.
Yeah. And actually, that's also, in a way, if we can sort of say how we work in Walker, it's very much over the long term, building trust, building relationships. And I'm thinking now our links, not with UK funders necessarily, but much more with, Met Services, with local agricultural services and so on. So it is very much, I think, as we've said, even in the introduction, that there's a kind of synergy, there's a shared ethos working long term and keeping an eye on sustainability, but relationships, people at the center of everything. So thank you so much.
Celia, also trust. The community also needs to know you're there for the long term. You're not there and then tomorrow, because they've been let down by so many NGOs. And now with the USAID funding, there'll be a lot of people, a lot of communities that won't trust charities because you came, you did this, and you just left. So we also work on trust, and we say we're here for the long haul, good or bad, we're here.
I'm sure that what you said about collecting the data is really important for those funders, because it gives them an evidence that the money is going to the people and helping the people they would like to help. So that's really, really important, I think, for funders.
And they can see the evidence. I mean, these two,
Yeah, exactly.
they're just the only two. There's more because all we've got
Living
things-
evidence.
they've got living evidence. So they come back and they work and they
Really
yeah. So it's living evidence.
That's fabulous work you're doing.
Thank you.
Gosh, well, thank you so much for all of this. I see that our online participants have said thank you so much. They've had to go
Yeah.
on to other appointments, but Neil, Ted, Andrew, Andrew, who is in International Development Department here in Reading, has said that he can see possibly opportunities for MSc students to work with you, and he's left his contacts. So we'll have all of those. And yeah, I know it's kind of middle of a working week. It's a little bit tricky to get the right people here, but we have recorded the session. And so, you know, if Nancy will obviously get that back to you as well. So if you want to edit it at any time and use it with your fundraising and with donors, that would be absolutely brilliant. I think probably, are we bringing this to a close? Are there any other questions, or are we now just Nasio and Walker in the room?
Mostly Nasio and Walker, yes.
Well, Team Nasio and Walker, well done.
Part of that Walker team. Team Walker, I love to be that.
Oh, you're brilliant. You're fantastic. So thanks for coming over, Nancy and everybody. And I have to say, Rajab and Eunice, I'm sorry I haven't seen you in person. I would love to see you in person. So maybe another time. I can't tell you how impressed I am. I've got a son who's medic, and I know how hard it is. How I just can't imagine. I mean, my heart goes out. I'm so impressed. And Eunice, all these struggles, it's so hard to be on your own. And you're wonderful, and just congratulations. And I'm so impressed also that you come back to those communities, that you're giving back. So great family. So yeah, thank you so much. And safe travels home, you two, and everybody. Thank you.
Thanks.
Thanks.